That's Catherine Da Costa there. Now, the strike has added to the growing strains on the Britain's state-run National Health Service, which many believe is now facing a crisis. I'm joined now by Stuart Hoddinott from the Institute of Government. Thanks very much, Stuart, for joining us here on the programme. It's quite horrific to think the state of the NHS, because it was once revered globally, and now I see these articles, I see these news reports about how dire things have gotten.
Yes, the NHS is clearly in a very bad state right now. I think there are a few complex causes for that. One of them is certainly the COVID-19 pandemic, which has hit the health service very hard. But we also need to understand the context in which the pandemic struck the health service. So our research shows in our recent performance tracker, which we released in partnership with CIPFA, that the decade of below trend spending increases for the service before the pandemic left it less resilient than it might have been if the pandemic had struck at a different time.
But it's not just about throwing money at this problem now, is it?
No, it's not. I think the lack of or the below trend funding has definitely caused problems. For example, with capital expenditure, the NHS has underinvested in capital, and by that I mean things like diagnostic equipment, repairing the actual NHS estate, so hospitals, GP surgeries, IT infrastructure and beds over the last 12 years. So I think there is an argument to make from an increase in funding, but also, as you say, it's not just about more funding, it's about where you're directing that funding. Are you directing it towards the right places, towards the place where it can have the most impact? Things like capital spending, like improving retention of the existing workforce.
And do you think the government is now looking at this and thinking, OK, this is how it needs to work out so that we're not in this position in 5 to 10 years' time?
I think the government, or the series of governments since 2010, have taken decisions to reduce the amount of funding that they put into the service. I think the most recent government, in the autumn statement last month, did show some signs of understanding the problem. So they put an extra 3.3 billion, or about 2% extra funding into the service for the next 2 years. But they also, and I think importantly, directed funding towards adult social care in the UK, in England, which is also a service that's been badly hit and which has impacts on the health service. So I think there is now recognition by the government that the service is underinvested in. The question now is if they will commit to longer term, more sustained funding increases.
Stuart, thank you very much for joining us. That's Stuart Hoddinott talking there about the issues that the National Health Service is currently